So welcome you all. In previous video of sedative and hypnotics, we have already discussed the classification, mechanism of action, and therapeutic uses of benzodiazepine and barbiturates. In this video, first we discussed the difference between benzodiazepine and barbiturate and certain other drugs which are used for the treatment of insomnia. Now come to what is the difference between benzodiazepine and barbiturates if they are used for sedative and hypnotic purpose. Benzodiazepines do not produce anesthesia, whereas barbiturate can cause loss of consciousness. Barbiturate have lower therapeutic index. Second difference is benzodiazepines are not enzyme inducers. Therefore, they do not produce metabolic tolerance. Whereas barbiturates are potent enzyme inducers. They can produce both metabolic tolerance as well as dependence. Next difference is benzodiazepine has very low abuse liability, whereas barbiturates have high abuse liability and it is responsible for tolerance as well as dependence. Next difference is benzodiazepine do not affect REM sleep, whereas barbiturate causes suppression of REM sleep. Therefore, on withdrawal, there is increase in REM sleep, which is a poor quality sleep characterized by nightmares. Next is benzodiazepine do not produce hyperalgesia, which means they do not increase sensitivity for pain, whereas barbiturates causes hyperalgesia. They increase the sensitivity for pain. Next is benzodiazepine produces amnesia, which means loss of short-term memory, but does not show phenomena of automatism, whereas barbiturate shows both amnesia as well as phenomena of automatism. What is automatism? In automatism, barbiturate causes loss of memory, loss of short-term memory. Patient forgets where he or she takes the drugs or not and takes it again and again, which leads to toxicity. Next is in subhypnotic doses, benzodiazepine can use as anxiolytic, but barbiturates cannot be used for the purpose of anxiolytic because barbiturate produces profound sedation, which is highly unacceptable. Benzodiazepines are very safe drugs. They do not affect respiration as well as cardiovascular function, whereas barbiturates causes depression of both respiration as well as cardiovascular function. For benzodiazepine toxicity, a specific antagonist flumazenil is available, whereas for barbiturate there is no specific antagonist is available. Now come to next group, which is a non-benzodiazepine hypnotics. Non-benzodiazepine hypnotics are nowadays commonly used for the treatment of insomnia. Non-benzodiazepine hypnotics includes zolpidem, zopiclone, S-zopiclone and xylitol. These drugs have specific action on benzodiazepine receptors. They are especially act on BZ1 receptors, which is responsible for their anxiolytic, sedative and hypnotic action. These drugs do not act on BZ2 receptors. Therefore, these drugs do not have myorelaxant or anti-epileptic property. These drugs have certain advantages. Number one, they do not affect REM sleep. Number two, these drugs causes minimum daytime sedation or minimum drowsiness. Therefore, daytime activity of the person who takes the drug does not affect. Number three, these drugs causes minimum respiratory or cardiovascular depression. Number four, these drugs do not have myorelaxant or anti-epileptic property. And number five, these drugs have minimum abuse liability. These drugs do not causes tolerance as well as dependence. Next drug is melatonin analog. Melatonin is a hormone which is released from pineal gland. Its secretion is induced or promoted by darkness, which help in induction as well as maintenance of sleep. Whereas its release from pineal gland is inhibited by light. There are two types of melatonin receptors are identified, MT1 and MT2. MT1 receptors is mainly responsible for onset of sleep, whereas MT2 receptor is responsible for maintenance of circadian rhythm. There are two melatonin analogs are available which are known as Remeltion and Tasimeltion. Both drugs are now used for the treatment of insomnia. They induce or they promote the onset of sleep. These drugs are now commonly used. These drugs are also nowadays commonly used for the treatment of jet lag. Next group is orexin receptor antagonist. Orexins are released from certain neurons of the brain, which is responsible for wakefulness. Orexin receptor antagonist Sedative is now used for the treatment of insomnia as well as for the treatment of jet lag. Some other drugs like antihistaminics and some antipsychotics are also used. They are used as miscellaneous drugs for induction of sleep.